It is that time of the show when we say hello to today's guest, and we are joined by Chuck Kiskaden, who is the president and CEO of Health Benefits Advisors with clients throughout Southern California.
Yes.
And Chuck, the reason why I asked you to come on to the show is I recently have started a search to look at my options as a small business owner for insurance. And one of the things that quickly became clear to me is that no one really knows what's going on and what's going to happen. So I was wondering if you could give us kind of your perspective of Obamacare, healthcare in California, past, present, and future.
Sure.
Because my understanding is it's really in flux, especially with the Supreme Court's involvement and looking at possibly disallowing certain aspects of the Obamacare program. Definitely the general election, who our next president is, whether or not we end up with a Republican or a Democratic majority, on the Hill. All of this comes into play. You know who I feel the worst for? Is you guys.
True, that is true. There's a lot of things up in the air as it relates to employers, employees, individuals, insurance agents, brokers like myself. A lot of people don't know what's going to happen based on what the Supreme Court does.
How do you write policies when you don't know what it's going to look like a week from tomorrow?
Well, in California right now, we've already had a number of laws in place. Of course, the healthcare reform law, Obamacare, started a couple of years ago, so some things have been rolled out. Prior to that, California already had a law in place called AB 1672, mid-90s. It was a guaranteed issue law for employers. So employers, small employers with 2 to 50 employees, had some feeling of sense of security, both from a product standpoint and a pricing standpoint. If they went to the market, they went to insurance carriers, got their broker to help them, and they said, hey, I need some insurance, they wouldn't be turned down. None of their employees would be turned down.
Even with pre-existing?
Even with pre-existing conditions. For small employers, different game if you're an individual. California, like the rest of the country, if you're an individual, you've got a medical problem, tough. You're on your own. Go ahead and try to get insurance. If you don't have it, there is a risk insurance pool in California that you can try to get into. Has a 1-year waiting period. So all those things were really tough. So this law did make it a lot better for and easier for individuals and for different groups of that type. It also has a lot of other things into it, which we'll get into as far as subsidies and things like that.
All right, well, that's good. Well, let's talk about kind of the evolution of healthcare in California, because California, as it seems to be on most issues, is different from the majority of the states out there.
True.
So let's talk about how that's kind of evolved, and then where are we now for individuals, for businesses, et cetera?
Right. Well, California, as I said, because of AB 1672, has evolved to the point where small employers do have a guaranteed issue. And the pricing is within a corridor of plus or minus 10% of rates that the carriers file with the Department of Insurance. So there's a lot of regulatory oversight, and a small employer can feel pretty comfortable they can get a good package at a reasonable price.
But there's still limitations on it. If you're a small employer and you offer it, you have to offer it to all of your employees. If you offer it to part-timers, you have to offer it to all part-timers.
Most insurance companies will require you to offer it to everyone that works more than 30 hours. And if you want to offer it to someone that works less than that, you have to get approval from the insurance companies. They normally don't allow part-timers to be offered coverage. Those are the folks on their own have to go find insurance, subject to pre-existing conditions, et cetera. That's correct. So there are some limitations. And these insurance companies also, they're kind of concerned about small employer, 4 or 5 people. Gee, they're going to bring grandma in or some cousin or uncle that needs insurance. So they're going to make sure that they're actually on the payroll. They're going to make sure that you as an employer are paying at least 50% of the bill for the employee portion. Mm-hmm. And they're going to make sure that about 75% of those employees participate. So they're worried, they're going to make sure they don't get adversely selected against.
So even for small businesses, it can still be kind of tough because it's another expense.
It is absolutely an expense, and it's an expense you don't know what the increase is going to be next year. All of the small groups, 2 to 50, are pooled together. If you've got 50 to 250 employees, that's pooled together. And what the carriers do is they look into the future and figure out the prices, how much costs they're going to have to pay for healthcare. Then they've got their administrative expense, profit, paying for the processing of claims, brokers' fees, et cetera. and they have what they set up as a cost trend. So the cost trend for small group right now may be 10, 12%. So you can sort of you can predict what your increase might be is because you're part of the pool. So that helps to give you some sense of comfort on pricing.
And in California, we've watched our prices grow incrementally by leaps and bounds over the years. And a lot of that has to do with fraud and unneeded operations. Is this Obama program going to fix that, make it worse, or we don't really know?
Since 2002, for example, healthcare premiums for employers have gone up about 150%.
Wow.
So what's going to happen in the future if you're going to pay for insurance right now, you're concerned about, and you're budgeting for it as an employer, you're concerned about what that cost is going to be. How can you control the cost? How can you get your employees engaged in wellness programs, take care of themselves? What are the things you can do as an employer? So that's the things that you can do as an employer right now. As far as looking into the future, what Obamacare is going to do, it had some things that kicked in immediately in 2011. If you're offering a package and your employees want to cover their dependents, usually they had to stop at 21 or 22 unless they were a full-time student. Now the law allows children to be covered all the way to their 26th birthday.
Wow.
That added 2.5 million.
Whether they're a student or not.
Whether they're a student or not, and that added 2.5 million people across the United States just because of that aspect of the law. Another thing is that the law changed to make sure that if somebody went in for a preventive services, a woman going in for the pap smears, men going in for colonoscopies, some kind of checkups and things like that, those are covered at no cost. If you've got a $2,000 PPO product with a $2,000 deductible, you get those services at no cost. It's not subject to the deductible.
Now, is that the same for an HMO, though?
HMOs, PPOs, everything. If you get preventive services, no cost to you right now. So those are good aspects of the law that kicked in immediately. The real significant time for the law is 2014. 2014 is when individual mandates kick in. That's when everybody has to buy insurance. That's when all the states are creating insurance exchanges so that individuals and small groups can go there and buy their insurance. All that happens in 2014. The Supreme Court, in what it's looking at right now, is the question of, wow, is it legal, using the Interstate Commerce Clause of the Constitution, to mandate that you and I, if we don't have insurance, we have to go buy it?
And that's the big question. Is it the states or the government's responsibility to force us to have health care?
That's the question. That's what the Supreme Court is trying to determine. Can the feds force us to buy insurance, and if we don't, to pay a penalty for that? And there is a penalty.
The pundits seem to be thinking that the Supreme Court is leaning towards pulling that out of Obamacare.
The pundits think that. I think that you could take a coin and flip it a couple thousand times and still not have the right answer, because
so you're not so convinced.
I'm not so convinced. I think that it's a very tough decision for the Supreme Court to say that what has been put in place, where mandates have been put in place before. A friend of mine did a program just recently. He's a lawyer on constitutional law, and he did a radio program, and showed where the Supreme Court, actually it was the Constitution, the founders of the Constitution, when they put it together, they had a mandate initially at that time because of interstate commerce that the people on the ships on all of the different canals had to have insurance. So mandates are not new, and so who knows where it's going to go.
All right, Chuck, we're going to take a quick break, and when we come back, I want to examine some of the possibilities, because there's many, of where healthcare may ultimately be heading.
Certainly.
So don't go away. The most interesting part of this conversation is yet to come.